Hey guys, Andrew Dowling here, Mitch Kurtz, and thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe to stay up to date with all that we have coming. All things AltMed? Yeah, that too. Okay.
Hey guys, welcome back for another episode of the AltMed podcast. Very pleased to say that we recently, I don't know what number this one is, but I think we recently ticked over 100. So for anyone who's still listening, still part of our loyal subscriber base, we're very grateful because I know you have to put up with my voice, Andrew Dowling here, by the way, and of course, my co-host's voice, Mitch Kurtz.
Hey. I was going to say they need to get a life, but yeah.
Yeah, no, are we at that stage now where we just insult our audience?
You just get older and crankier as you do more and more episodes.
Okay. No, that's very grateful for anyone that listens. And if you do like these podcasts, please remember to hit like and subscribe wherever you get your podcasts if you haven't done so already. Now, on to today's exciting episode. We have with us none other than Dr. Amy Carmichael, who is a leading authorized prescriber, cannabinoid clinician, but basically just a great cannabis doctor that we know, based in Queensland, but services Australia-wide with online telehealth. Dr. Amy, welcome to the show.
Thank you. Thanks for having me. As long as you guys don't, diss the interviewee, then that's okay. Diss each other.
Just the audience. That's it for us.
Yeah. That's good.
So, as is customary on this podcast, we love all the different stories of everyone who's found their way into this crazy industry. So, what is your story, Amy? How did you find yourself prescribing cannabis?
Do you want the short or the long story?
Long.
Okay. Okay. So my background was in acute medicine. So I used to be one of those crazy individuals that would jump on people's chests and put big central lines and things in people when they were dying. And I love the thrill of acute medicine, and I love helping people and seeing a big change around quickly, because most medicine you don't get to see the results so quickly. So I really thrived off that environment and working in teams and things like that. But just through kind of the long hours of that kind of work, I kind of suffered my own health problems. So in a mix of trying to do everything, being a bit of an A+ personality, as most of us are in the industry, I found that I ended up getting really stressed and burnout. And I suffered a lot of IBS and anxiety. I masked it very well, again, like most of my patients do. And, I'd wear it with like a badge of honor, like, working hard, play hard. But it did get to a point where I was pretty exhausted, and that ended up with 2 broken legs. Just from doing too much, really, and the universe decided to stop me in my tracks. And then I kind of went down this kind of holistic route to heal myself. So rather than being given lots of opioids, which I tried, it made me feel really nauseous and constipated and kind of like a zombie, I wanted to try and find other ways to heal my leg, and then also realized that I couldn't work the hours that I was doing. So I went into nutritional medicine, functional medicine, lifestyle medicine, did pretty much everything I could like absorb for like 5 years. And then also did aromatherapy and NLP and yoga and personal training. So I covered everything that you could think of really in a holistic framework. And I found that using non-pharmacological interventions was the best option for me. And then strangely enough, like through aromatherapy and through just really keeping an eye on what was happening in medicine and how, it was an emerging form of an innovative way coming through with plants, with medicinal cannabis, it was just intrigued me. And I was a bit scared actually, because my own personal experience as a young teenager with cannabis was not a good one. So So I was a little bit apprehensive actually, but
what do you mean by that?
Amazing. Oh, well, I'm English, as you can probably tell. And we don't live very far from Amsterdam. And I was 18 and it's legal in Amsterdam. And I decided to go to Amsterdam and go to the cafe where the famous movie, I think it was with James Bond, was filmed. And anyway, I love chocolate, as most women do. And I saw these amazing chocolate kind of muffins and decided to devour one in the space of about 10 seconds. And as you can imagine, they were full of cannabis, which I knew, but I didn't really understand the effects it was going to have. And then that followed by me being in the Heineken Museum and essentially having like severe paranoia with people being very slow and looking at me very weirdly and basically requiring me to go home because all my friends were laughing at me and me just wanting to I just did not want to be on this earth. So it was not a fun time at all. So that was my experience.
That was the first, okay, because I think a lot of people who are listening might have also had a bit of a dicey first experience if they, whether legal or not, recreational use and just not understanding what they were having or anything. I kind of get a little bit jealous actually of people who are trying cannabis for the first time, you know, with the supervision of their doctor, someone that can actually explain to them dosing and everything like that. Because it wasn't like that for me. When I first had it, I didn't get to be somewhere as interesting as Amsterdam, but yeah, it was very much a roll the dice exercise. I think I can divulge that the same is probably true for you, Mitch, if you don't mind me saying.
Yeah, I've had both experience. I understand the full gamut of possibilities. When engaging both, recreationally, that's for sure. Although in the early years, my first experiences were all very positive. It was actually later on when I did some more exploring that things got a bit dicier, let's say. But this isn't about me. This is about Dr. Amy.
Well, I think that though is all a pretty amazing story. And I think one thing that really I was reflecting on when you were describing that period in your life where you're working in emergency medicine and the hustle and bustle is just that idea that, you know, in a lot of workplaces when people get stressed in their work, you know, it's not fun. Burnout happens almost inevitably. But to think about that type of environment in a hospital where the patients aren't having a good time, their health is clearly, you know, on the rocks. And then you've got all these doctors that are masking stress, the stress of that, you know, having people's health and livelihoods really in their hands. I can just imagine that is like a melting pot of stress, anxiety, and people just kind of having a short fuse and all of those things. So you probably, do you feel though that in a weird way, when you come from an environment like that, where you were forced to perform at the highest levels in that against that backdrop, that it actually helped you where you are now to even appreciate just maybe a lot of where you're at this point in your life?
Yeah, completely. Yeah, it's I'm basically high functioning, and that element of anxiety and perfectionist definitely allows me to focus and be competitive and strive and, you know, constantly learning and constantly self-critiquing myself. But it's a double-edged sword, definitely. It's not without its own rippling effects that can, you know, go into your family and your day-to-day life and then your mental health. And so I think it's just a matter of being constantly self-analyzing and really starting to look at the way that who you are as an individual and what your blueprint's like. And it's okay if your blueprint's similar to mine. Most of my patients that come to me are entrepreneurs, visionaries, people with big missions. I tend to attract these types of people. And I think every time I hear a patient story, it's as if the words they're saying are exactly my words too. And so I can really relate and empathize with people in, you know, stressful businesses and, you know, working long hours where they can't just shut the front door and just forget about things. You know, so yeah, it's extremely stressful. But I think now looking at all these different strategies, everything's a choice, right? So if we can day to day, minute to minute, hour to hour, start to make good choices, and we don't always make good choices, but I think if, you know, using things like medicinal cannabis has certainly been a good choice for me in my own personal health. And I've only ever seen positive effects with my patients. Very rarely do I see big side effects. They're usually very mild. So
your patients aren't on the chocolate muffins at this point in time. Okay.
No. I mean, some of them definitely, they definitely ask me. They say, hey, can I, you know, use this in cooking and stuff? And a lot of people prefer to use them in cooking. So, I suggest different recipes, which often involves chocolate. But, you know, it's in a dosed format. So they've figured out their dose of their oil usually before they start experimenting and just chucking a load of oil in like a cake. A cake tin. So yeah, they can actually get really precise using an oil when they know what dose they're using. And usually it actually works really well for those more elderly patients that just want to feel like it's quite normal for them to have their brownie or their biscuit. You know, they quite like that. And especially people, women with children, there's still loads of stigma. It's something I'm really interested in, but women with cannabis, it's just a constant educational kind of battle that I have, just kind of trying to explain to them that it's a medicine, and they're really not wanting to use flowers. They're not wanting to vape. They're wanting to hide it from their family or from their employer. And, you know, it's really starting to think about how can we change the culture with women in cannabis. It seems so acceptable for men, but for women, it's still this, you know, it's kind of not really for us.
I agree entirely with that, and I find it so strange. But I completely agree. I don't know how it happened. Maybe people's perception of, you know, who a stoner is before we even had legal access to medical cannabis. But this idea that, you know, young men who, you know, it is really interesting that we've totally, I guess, kind of gendered the whole conversation in a way. And you know, I know that particularly when you look at conditions like endometriosis, and there are so many women who I'm sure have been helped with medical cannabis for their respective health conditions. So yeah, what do you find that sometimes when you have a female patient for the first time, that you have to say, by the way, you know, it's completely okay to have cannabis. It's not just something that the guys do.
Well, I mean, they're usually the ones that are quite upfront. They usually say, I ask every patient, you know, what do you know about cannabis? Because most of my time is spent educating on the phone. And most people, you know, even recreational users that, you know, have used it for a long time actually don't know heaps about, especially terpenes, which is another one of my favorite topics, but they don't know heaps about cannabis. And so often women will come onto the phone and I'll say, what do you know about cannabis? And the first thing they'll say is, I don't know much, but I don't want a flower and I don't want to vape. And like vapes are really bad for you, because it's all over the news that vapes are really bad for you. And they're obviously, as you know, they're talking about the nicotine, like fruit flavored vapes that are not medicine, are not approved, and have like carcinogens and toxic substances, volatile compounds, right? So they immediately put vaping into the same category. And then even if I can educate and kind of, you know, a lot of them will trial oils first, you know, with the hope that that's going to be enough for them. And obviously, as you know, lots of patients do need a flower, because we know with the entourage effect that we know that it's not just the THC or the CBD. We know that, for me anyway, it's definitely got a lot to do with the terpenes, which is what I end up educating them about. And they'll often say, okay, yeah, I'll use a flower, and then they'll get the vape, and then they'll say, oh, well, I can only use it when the kids are out. And then it's again this conversation about like, how old are your kids? Like, have you had any conversations about like, this is the medicine that is for you because it helps you become a better parent, it makes them happier, they don't snap as much, you know, and you know, they're able to be the nurturer and the caregiver that a lot of the women are. Not all women are caregivers, but a lot of them are, for family or for parents and people. And I find that conversation is a difficult one because people have different beliefs on cannabis, even though it works. The issue is not that it doesn't work. The issue is, how can it become normalized in this culture? And I feel like it's a constant battle at the moment. So, yeah.
No, that's really interesting. Sorry, Mitch,
explain to them that if they want to not use flower or vapes and they want to use oil, that it's like 5 times stronger when they have it as well.
Yeah. All of these things.
Maybe that's the appeal.
Yes, maybe.
Yeah, I think we do find that with women have a bit more of judgment or pressures on them to be a certain way, let's say, and younger men just don't really they're just whatever they want to do, they're just like, I'm going to do that, and off they go, whether or not they have kids. Now that's a generalization, but I do think that maybe influences it, although we are seeing the trend. The data overseas in North America shows that women are by and large becoming more and more involved in cannabis. There's different brands that are starting to be targeted specifically at women. There's obviously some products that specifically lend themselves to women more so than men, suppositories, things like that are coming out. So I think that it is changing, but you know, when you think about the classic stoner or of yesteryear pre-medical, it's a very male-dominated market, I would say.
Yeah,
it's even male dominated in the industry itself. I mean, even as a clinician, like there's not as many female clinicians as there are male. And there's also even the product suppliers, you know, the growers, there's not as many females in that. Like I noticed that as a female going to medicinal cannabis conferences that I'm outnumbered. And for me, you know, like I'm very holistic, I'm quite spiritual. Like for me, I think sometimes the heart of the plant, you know, being a female plant, the heart of the plant is sometimes forgotten. And I'm often talking to patients about their intention of when they use a plant. So, you know, sometimes I'll have recreational users that have used it a long time for like insomnia or anxiety, and then they want to get a legal prescription, which is completely fine because they've, you know, they're eligible under certain circumstances, right? But what happens is they become so disregarding of the plant, and they want to constantly change the plant. And, you know, I'm quite stern in my like devotion and gratitude to the plant itself and the lessons it can give. And sometimes I'll have to say to patients, particularly those people, not always men and women, but particularly those people who've used it for a long time, and say, oh, there's no difference between the different like cultivars, or, you know, they say strains, you know. And I'll often say, you know, I use the analogy, which is probably not, I don't use it with every patient, but I'll say, you know, do you have like multiple girlfriends? Like, do you sleep around? Like, or do you have like a relationship with the plant? Do you have a relationship with a woman? Like, that's what the plant wants. It wants to be devoted. It wants to hold a strong intention. And that intention doesn't need to be super spiritual. You don't need to be in like a Buddha pose and like mantra music, but you could just say, hey, I really want to have a beautiful sleep tonight. And I think that a lot of my patients are really grateful for when I actually like pull them into line and go, oh, like I actually haven't really been respecting the plant. And the plant has been there for most of their lives. A lot of the recreational users, they've had it for a long time, and no one's really said, hey, but you're not really using it appropriately, and you're not being fair to the plant.
But surely you get patients that are like, I just want to try every single different flower when you put it in that.
You do. But again, I talk to them about the terpenes, and I talk to them about, you know, there's particular plants that are going to give you particular lessons and make you feel a particular way. And let's really like sit with an intention with these particular plants. Like I'm very straight down the line and strict on my prescribing. I follow the TGA guidelines, and you always have patients trying to abuse the system. But, you know, as a doctor, that's our job. Our job is to ensure that it stays medicinal and used appropriately rather than being abused. And there are practitioners and companies that prescribe multiple. You know, I have lots of patients that come to me from bigger clinics or from other practitioners that have prescribed several flowers all at once, and then they also get confused by what they're meant to be using. So it ends up being that the patients actually want a more tailored approach, more personalized approach. And when you explain to them and listen to them about their history and what their symptoms are like, you know, my anxiety may surface, may look different to what your anxiety might look like. And so when you really listen to the patient's history, it's not as simple as we all get the same flower for anxiety. I choose my flowers based on the terpene profiles. And that's because I want to know, what does the patient want to feel? What are they trying to achieve by using this sacred plant? And then I pick the plant that's appropriate.
Yeah. Yeah, great. I mean, it's also the mixing of different flowers. I mean, I can imagine from a patient's point of view that, you know, they try something and then they have another flower and maybe another one. It's sort of like, well, now it's getting harder and harder the more that you almost dilute one with others to tell exactly why something may be working or not working. And sometimes I found just the effects can compound from multiple flower use. So it's I don't know, like a good bottle of wine, best to just sort of enjoy one at a time, I think.
Yes.
It's a very.
I was going to use the relationship analogy again, but I won't use it.
No, yeah.
It's a very holistic approach I think you take. I'm also curious about your background in aromatherapy and how that kind of ties in. Sorry.
Yeah. Well, when I came into cannabis, I got taught by a great lady, Dr. Kylie, and she talked a lot about terpenes. And, you know, this idea of terpenes is foreign to pretty much everyone. Even the endocannabinoid system is foreign to most doctors. But terpenes I just knew because I'd already done an aromatherapy diploma. I've used essential oils for pretty much about the last 10 years of my life, because when I learned lifestyle and functional medicine, I learned a lot about environmental medicine. So I knew that I didn't want any kind of toxic chemicals in my home. So I clean all of my own home with essential oils. I use essential oils on my face. This is how I try to stay young. I use it on everything. And so, you know, I know that, you know, the difference between, let's say, lemon essential oil, which has got high in limonene, is really good for focus and energizing, because just when you smell it, versus lavender that's got linalool in. So when Dr. Kylie was, you know, educating me, it was really interesting because I was like, oh, okay, I know this like the back of my hand. And then now, like when I see patients, I have all of the products up on a kind of like a Excel sheet, which obviously nowadays there's lots of products, and I'm really interested, like writing down, or hopefully that they're already written down, that all of the ingredients with the terpene profiles. And so I don't always look at the THC and you know, CBD content's important, but I'll often just look at the terpene profile and what the patient's requiring, and whether they're cannabinoid naive or not will depend on the THC. And then I pick it based on that, really. And so I wouldn't be using an essential oil if someone's like a lemon, if someone's trying to relax. Like I'm going to be using that when they want to focus and study, right? And it's exactly the same with cannabis. There's a big misconception, and this is another kind of myth with a lot of patients, is they only think that cannabis is sedating. They don't really understand that it can be uplifting, really good for concentration, for like ADHD and ADD patients, you know, and just those people that are generally anxious and stressed, like they become overwhelmed and they just think, oh no, I can only use it at night to relax. It's like, no, you can use it in the day. Obviously, you know, remembering the driving laws, but, you know, a lot of these people work from home and stuff. So yeah, that's how I end up using kind of my aromatherapy background to be able to pick the plants really nicely for patients. And I think I do that really well. Like I do that well because observationally, patients often have a good response with the first flowers I pick. And I think that's from my background more than anything. And it's not being stuck to one or two products, which, you know, as you know, like there's certain companies or practitioners that are, and then that's that medical bias, which is technically illegal. And so, you know, for me, it's like, as an independent practitioner, it's like, you know, I want to make sure that my patients have the highest quality flower that's personalized for them, not just based on giving them only one particular brand. So yeah, I think all independent practitioners pride themselves on that. And I think we should have more you know, hearsay in the industry than big companies sometimes. So yeah, sorry, I went on a tangent.
We love tangents. We're all about the tangents.
Yeah. The entire AltMed podcast is actually just one long tangent. It just keeps
going. Good. Okay, good. We'd be here for hours.
Yeah, we totally could. I wanted to ask you actually just on that point around I guess the relationship between, you know, doctors and the suppliers of all the products. I mean, I guess, you know, in the 3 years or so that I've been actively working in the industry, you know, going back to 2020, say, there was only a handful of doctors and a handful of suppliers. There's been a proliferation in both the number of online telehealth clinics, but also the number of sponsors/suppliers. Do you feel like we've reached a sort of a saturation point where are you getting contacted all the time about new products, or have you kind of at this point anyway settled on, you know, those that you're comfortable working with? And I should just make a note that we generally don't mention any products by name on this podcast.
No.
Yeah, where do you sit with all that? And have you found is there a lot of marketing that goes on?
There's 2 points to this. So as I said, as a medical doctor, all medical doctors are under the same authority, which is APRA, and we should not have any medical bias. And I do know there are clinics that you will only prescribe their products. So I don't agree with that. And I think it's unfair to the patients. With regards to what products I use, it's constantly evolving, constantly changing. And I think the point I really want to make about this is I talk to a lot of GPs that don't prescribe cannabis, right? Because I want to educate them either to come into the space to use for their patients, because most GPs don't have much time, but they have very chronic conditions. And usually the patients with the chronic conditions that have tried multiple medications, they're really our patients, right? They're the ones that we really want to see. And they're kind of the ones that are a bit of a headache for the GPs, not because they don't like them, but because they feel like sometimes they're not getting anywhere, no matter what they try, right? Whether that's anti-anxiety meds, or whether that's like they've got chronic pain and then they've gone to a pain specialist and they've gone and had, you know, joint injections and steroids, and they're on like 5 different types of painkillers and still not got a good quality of life. So for me, it's educating them. And then what I find is that the GPs will, if they're slightly interested, they'll often pick 1 or 2 products that they're comfortable with, right? But they don't know the range of products. And they also don't feel very comfortable at titrating up to like maximum doses. Or let's say, for example, a GP has a patient that's got pain. They start them on something like a 10-10, so 10 milligrams of THC and 10 milligrams of CBD. And they titrate them up. And let's say it just they get to 1 mil, which might be the max dose, and the patient's still not got good relief. Then the GP will often give up on that patient. They'll often say, oh, you know, it just hasn't worked for you. It doesn't work for everyone. And so I get patients coming to me being like, oh, well, my GP did put me on this, but like it didn't work. Like they didn't know if there was anything else. And so when you're asking me the question about like the different companies and different industries, I think really it's going back to how can we really take the load off the GPs who are already really stressed and really busy with big amounts of people, like lots and lots of people coming through the door to them. And how can we ease that and actually give the patient the best medicines and, you know, really be a specialist in our own right, because the GPs won't often have the time. So for me, it's about doing that. And then, you know, I don't know how any GP who's running a normal GP practice would ever be able to basically keep up with the products, because I find it hard to keep up with the products, and I'm interested in the products and I live and breathe it every day. So how is it that a normal GP would be able to do that? So it's not saying, it's not taking these patients away from the GPs, but it's really starting to say, hey, you know, it's an evolving, emerging area of medicine that, you know, if I was to just stick to one or two brands, I don't think I would be doing my patients the best interest. And if a company comes out with an amazing product and me just to say, oh, but I'm just happy with what I'm giving right now, I think, again, I'd be doing my patients an injustice. So I think it's part of my career to constantly keep my finger on the pulse and to know what studies are being done, to know what brands and what flowers and what oils are coming out. And and I feel sorry that the GPs don't have that time. And I went again on a tangent, but I think it's more about the patient being in the best patient's interest.
Yeah, absolutely. And I think it's, being flexible as a prescriber. It's hard though, as you say, there's just always so much information. Every few months I go and have a look on the TGA's published list of all the different category medicines. And it's just like, it's just growing and growing and growing. So don't envy the spot that you guys are in. I wanted to just query, I suppose, what have you found that, I mean, a lot of when you described it at the start of this podcast, the journey from, I guess, being in that emergency medicine, burning out, finding functional, nutritional medicine branches, and even, did you mention yoga, I think, at one point? But yoga. I get a sense that you're what I would maybe describe, I've heard others would describe as like medicine. I don't know if we're at 2.0 or 3.0, but this idea of, rather than just going and seeing your doctor when you require acute care for whatever reason, you're really championing ways that people might actually be able to prevent any bad health or adverse health outcomes. So in a sense, the really cliche preventative medicine, eating well, living well. Do you find, have you found that just because you are a holistic practitioner, that you have people that come to see you who may be, I don't want to say they're not ill, because I'm aware of the fact that in order to access medical cannabis, you do need to have a medical condition. But do you think that there is, I guess, an openness from, the community to actually explore this as a kind of supplement or in conjunction with just leading a healthy life, and that maybe they just want it for their own well-being?
Yeah, 100%. I mean, as I said, most people that naturally get drawn to me are usually like entrepreneurial, and they don't even have to be entrepreneurial. They just have a big mission. They just have something in their life that they want to achieve. And most of those people are kind of A+, often have like ADHD, ADD, anxiety, high performing people. And these are usually the people that haven't been to the GP, because one, there's a stigma that they go to the GP, they're just going to get put on, an anti-anxiety med or Ritalin or something. And their beliefs are that they want to do something more natural. So the side effects for them outweighs the benefit of taking a conventional therapy. And so they would still be eligible for medicinal cannabis based on their beliefs. And, often they've had like a family member that's, been on an anti-anxiety med or something, and they've seen the way that they react, or an opioid, and they really have a very big trigger around taking those particular medications. And so, prescribing medicinal cannabis is one thing, but as I said, it's everything else around that, right? So a lot of people in that situation are anxious or ADD, and they don't sleep. Like, they have terrible sleep, and they can't switch their mind off. And so, as well as prescribing medicinal cannabis, like, I'm always talking to them about the choices they make before they go to bed. It's like people don't realize that having a shower or a bath will cool their core body temperature down, which will allow them to relax more before they go to sleep. You know, they don't realize that eating at particular times is going to make a difference to their sleep cycle. So I think it's very easy in this industry to just be a prescriber, just be a pencil pusher of medicinal cannabis. But I think the real change is going to coming when, you know, I believe the best doctors are the ones that stop patients having to constantly come back to you, right? And that they start being in the driver's seat. And I often say to people in lifestyle medicine, you know, like imagine your car, like in England we call it an MOT, but here it's just like a service, right? Like you take your car like at least once a year, probably should be twice a year to the mechanic to get checked. But like how often do you just go and get yourself checked out? Like nowadays people are getting sicker earlier. You know, we've probably all had family members that have died at young ages, and it's a bit of a wake-up call. You know, I'm turning 40 this year and I'm like freaking out. I'm like, wow, you know, like I'm not invincible. Like my health is like the foundation of everything. If I lose my health, like everything else falls apart, like my house, my job, everything. And I think there comes a point in people's lives, whether it's through their own health problems or through their family, and particularly women are good at this, expressing and talking about, you know, what's going on with them. And so that we're able to actually go, no, we actually need to get help. And so now people are starting to say, yeah, well, you know, it's on things like Joe Rogan's podcasts and, you know, Tim Ferriss. And so people are starting to be more educated on, oh, okay, well, at least CBD can relax them. So if they're not sleeping very well, we know that CBD will relax us into the parasympathetic nervous system. And we know that it will like allow us to have like an anti-anxiety effect. So then it has this ripple effect for their sleep. They have better sleep, and then they become extremely productive in the day. When they're productive in the day, they get more done in their business, they earn more money. Like they create more time freedom for them and their family and a better quality of life. So I think people are starting to realize that they can work backwards and have a preventative healthcare model. And I think that happens really, and again, probably mainly through women, will be women sharing these stories. You know, I had a lady yesterday with really bad arthritis. And she was so scared about taking CBD and just using CBD, no THC. She was like, her pain score's now 0. She's not taking any of her pain meds. And she said to me, you know, oh my goodness, I've got to tell like everyone. And, you know, I got to tell my sons and all my family and my cousins. And, you know, this lady is in her like 70s, you know, probably the biggest age group that would probably have the most stigma around using medicinal cannabis, right? And yet here she is like sharing, and then literally is then referring on all of the other family members that have other medical problems. So, you know, I think people don't realize the different benefits of CBD and THC until they start taking it. And they may only be for the insomnia, which is their initial thing. Oh, I'm not sleeping very well. But then the ripple effect of that is that they get a lot more done. They can run around with their grandkids. They can actually like be awake in the day and not feel like they're getting overwhelmed and procrastination. And these kind of quality of life indicators, they're subtle, but they're actually how we live our day-to-day life. Like that's the things that make the biggest difference for people. And there's not enough studies on it yet. There's not enough studies on this kind of subjective feeling that people get when they take different forms of medicinal cannabis. So I think that's an area that needs more research.
Yeah. I'm also just curious, and in the interest of a balanced conversation, how many times does a patient come to you and you say, you know what, medical cannabis is not actually the appropriate course of action here, but you need OxyContin, I don't know, you know, some kind of benzo or whatever it is, and a conventional medication. Yeah. Fentanyl directly in the eyelid.
I would say 99% of patients have already checked their eligibility before they come. And therefore they're eligible. And so I don't have to turn away heaps of people. Definitely people that just want to abuse the system. But I think I haven't had to I definitely refer people back to their specialist and their GP when appropriate, but I haven't had to then say this particular medication would be better for you, actually, because most of the patients have already done their due diligence before they get to me, which makes my job easier, right? And, improves the expectation of the consultation. So yeah, I haven't, that's not been common for me at all, which I'm actually really thankful for. Obviously, if it was needed, then sure, I would definitely suggest it. I think, unfortunately, most people that do end up coming to medicinal cannabis do have a belief that they want to be using more natural products, and they are really worried about side effects. And so they're usually very well educated before they come to me specifically. So it's not common in my practice.
Okay, well, I guess on that, what are the types of things where you do turn patients away? Is it like pregnant breastfeeding, for example, or a history of bipolar disorder or schizophrenia, or do you prescribe them potentially CBD but not THC? Or I know some of the ones that we tend to check for include like hypertension and kidney or liver function, for example, and things like that.
Yes. Yeah. So there's not that many contraindications, but definitely people who have severe renal failure, severe heart failure, have had a recent acute myocardial infarction, a heart attack. They're definitely people I am more cautious with, and often will work alongside their specialist before then. And at the moment, there's like no studies to say that it's safe in pregnancy and breastfeeding. So we're limited on that. With regards to bipolar, bipolar is one of the conditions that the TGA says it has potential benefit for. So bipolar is still a condition that we treat. So schizophrenia is also a condition that's under the TGA that can be treated. Obviously, those patients we have to be extremely cautious with, and usually, again, alongside their psychiatrist and psychologist. And it wouldn't be when they've had a recent psychosis either. And as you said, we'd be really looking at like, how can we titrate something slowly? So using CBD probably only with an isolate first, and seeing what effect that has on their kind of mood and behavior, really. So they're the main things. There is some drug interactions. Often the patients are trying to get off their drugs, and we're always advising them. Patients get a little bit happy when medicinal cannabis works, and they're like, I just want to come off everything. And you're like, no, just stop. So it's often having to tell people, just stay on your medications. We're going to keep an eye on your renal function or your liver. Let's get you up to a good dose on what we think is working for you. And then we look at titrating down your medications if it's appropriate. So that's probably the commonest thing, is patients just withdraw and take themselves off their own medications is probably one of the biggest problems, even though we advise them not to. They just do.
Yeah. Are you prescribing it as the therapy to use, or in some cases as an adjunct therapy?
No, adjunct. It can work in combination. Again, it will depend on the patient. You often will have patients that come to you and they'll say, hey, I've been on Lexapro for 5 years. I really don't like it. It makes me feel like a zombie, but I've tried myself to titrate it and come off it. And every time I try and come off it, my symptoms come back again. And so they actually can't come off it. So that's when I'll treat them with a personalized treatment plan, and then get them to where they are. And then again, alongside them, that, they may be adamant, hey, I don't want to be on this. And I'll say to them, you may not be able to come off it. It may not be a drug that we'll be able to reduce or remove for you, but we'll see what we can do. But only once patients are stable. It's not anywhere near the beginning of their journey. And I think really, it's a basic kind of communication thing that we get taught in general practice and in medicine, is the ideas and expectations of patients can sometimes be very different to what we think they want. And so, the best jobs are done when we know what we think the patient wants. And then actually giving them, hey, no, it's not going to quite work like that. You know, I've had some really interesting, good patients who have been addicted to different substances. And, you know, they've, again, kind of been brushed off a lot by different people because they're recreational users in different drugs. And, you know, and with alcohol and things. And we can use medicinal cannabis to reduce substance abuse. And they are extremely coachable when they're ready, when they're ready to make a change, and they finally find someone that's going to listen to them. They will do everything, and they will do it to the T, because they've kind of almost got 1 or 2 shots at it. And then if someone gives up on them, like, it's very hard to find people that will work alongside patients with addictions unless you're an addiction specialist, right? So I find that those patients, they really do follow kind of the guidelines and often, you know, do extremely well by reducing their drug substances.
Have you heard of anything bad ever happening to anyone that just sort of suddenly stopped taking CBD oil, for example?
No, not with CBD, more with like gabapentin, and a lot of people stop their gabapentin. It's like, right. Don't stop your gabapentin. Yeah, no, not with CBD. I mean, probably the commonest thing that I hear is, and I also tell patients, this is pretty common. Sometimes patients feel a bit like tired when they first start CBD. They'll say to me, oh, you know, like the first week or 2, I was like, oh, it's just like, I feel rubbish. And I'll often now, because I've had so many patients say that to me, I'll often say to them, you know, it's actually your nervous system. It's a bit like a car going 120 kilometers an hour. You've been racing, and I'm going to step you back down to 80 kilometers an hour. So you're going to feel tired for the first week or 2. And then things just kind of like balance themselves out. You kind of get this homeostasis and you reset yourself with your nervous system. And patients, again, because I've explained it in like that analogy, they're like, oh, okay, like that did happen, but I wasn't scared. And now I feel much better. And now I've got energy. But the first week or 2, sometimes patients can feel quite tired. And if I haven't shared that with them, especially if they're elderly and they start to feel a bit more tired, they're more likely to come off their CBD, because they don't want to be more tired than they already are. So yeah, that's main side effects. And I did have a patient, an elderly patient who was cannabinoid naive, so never had any cannabinoids before, and again was like an rheumatoid arthritis patient. So really bad pain in her hands, really bad quality of life, like really poor strength. And she went to her GP, and the GP put her on quite a high dose of THC oil, and she basically was high on the THC. So she just had complete change of perception of things in her room and her environment. And so when she came to me, she was like, I don't want any form of THC. And obviously on further questioning, I found out like the dose of the THC, and the dose was much higher than what I would have personally prescribed. And so I was like, okay, let's just like go right back, which is like the basics that we all know, right? Start low, go slow. And she was like, she was really like scared, but we got her on like 1/5 of the dose that she had been prescribed before. So usually it's that sometimes prescribers might not know exactly how to prescribe, or sometimes it's that the patients are coming off their meds, and that's usually the problem.
But it is interesting that, people maybe just have that first reaction to their new medication with cannabis medicine, and they go, oh my goodness, this is a game changer for me. And they just get super excited, want to turn off the tap to their polypharmacy that they've been on for years. And it's like, whoa. Yeah, but all those drugs are technically, like, a lot of them would be approved drugs, and yet they wreak so much havoc with the side effect profile. And cannabis being unapproved, yet you can step away from cannabis without those side effects. So go figure. Anyway, that's a rant for another day. Or certainly one that I've done here before. Dr. Amy, we know how busy you are, and we just want to say thank you so much for coming on the show. And for what it's worth, when you said before that you were approaching 40, I just refuse to believe that. We'll have to get your tips on the essential oil routine, mainly for Mitch, actually. But I'd be interested to know as well.
Rubbing CBD oil into your face.
Yeah.
just topical with the essential oils. Yeah, no, we'd love chatting with you. And yeah, I think for anyone listening out there, if you would like to see a cannabis doctor that will really give you a bit more of a focus on preventative medicine and help you. I loved what you were describing actually about picking the right flower based on, people's, I guess, aroma interests and that sort of thing. But
you actually can't spruik that, Andrew. If you want to see a doctor for a holistic take on your health, then you can always see Dr. Amy.
Yes.
There's no guarantees that you're an appropriate candidate, and you should know that.
No, I thought that we were talking just about lavender and other just things that aren't scheduled.
If you want to see a cannabis doctor around terpenes.
Yeah. No. I'm just all about the terps, Mitch. How dare you? No, thank you so much, Dr. Amy. We'll look forward to catching up with you when you're next in Melbourne.
Yeah. In the week.
Yes, exactly. And
see you in 72 hours.
Yeah,
exactly. Time to party.
I think all the recipients of the Cannabis Awards will be announced. But well done to everyone who got an award. And we don't know who you are right now, but yeah, congratulations on
the results will be out by the time this comes out, though.
So. Yeah, exactly. So I was going to say, well done for nominating yourselves and getting the gong. So
we did it.
Yeah.
Exactly. All right. Until next time, take care, Dr. Amy. Lovely to chat.
Awesome. Thank you.
It's Andrew Dowling here and Mitch Kurtz. Thanks for joining us for another episode of the AltMed podcast. Make sure to hit like and subscribe because we have way more content coming out. And you got to stay up to date with it. It was good until you did that. Okay. Sorry.